Hi guys, we are back again with another classification of disorders or another set or another class of disorders. So today we'll be talking about the psychotic disorders. So we have done anxiety disorders, we have done affective disorders. Today we are going to be doing psychotic disorders. Now, like we always do, we understand that generally every disorder we see under this classification has several similar symptoms, right? Just like we did in other ones. Now, the psychotic disorders, the word psychotic or psychosis, it refers to a situation of losing touch with reality, when you are unable to differentiate between real and unreal situations, right? These individuals or this set of disorders in this classification have several symptoms like delusion, which we'll explain later, hallucination, and disjointed thinking pattern, and other related symptoms. That is for these category, the psychotic disorders. We call them psychosis. These are having these psychotic symptoms, problem or alteration from reality. Yes, altered reality. Right now, in this category or class, we have several disorders. We refer to them as psychotic disorders. They include schizophrenia. They include schizophreniform, is schizoaffective, substance/medication-induced psychotic disorders. We have delusional disorder and brief psychotic disorders. These are the disorders under the psychotic disorders, and we have emphasized the general symptoms. In each of all of these, you can be ready to see most of those symptoms we mentioned and many others that specifies them or differentiates them or that makes them unique from others, right? Yeah, schizophrenia, schizophreniform, schizoaffective, substance/medication-induced disorders, psychotic disorder, yes, delusional disorders, and brief psychotic disorders. These are the category here according to DSM-5 TRAPA 2022. Now, the most important one we'll be glad to look at here is the one we refer to as schizophrenia. Yes, schizophrenia. Very important. We look at it. When you see the word schizo, that means there is a division. Then frame, yes, meaning mind. Is it a Latin word or Greek word? Please, at the comment box, help me out there. Yeah, I'm losing touch with that particular one, but not with reality. Yes, I'm very consonant and congruent with time and space, and yes, so so please, frame, Latin or Greek? I think it's Greek, and I think it's Latin. Please, at the comment box, let me be acquainted with that or clarified. So, meaning mind, right? Yes, meaning mind. So if I could remember Greek, psych means mind, right? So maybe this one is Latin, I don't know. Please, let's clarify that later. So schizo, right? Division and mind, altered from reality, right? Now, well, let's be very clear, because this is a topic we will do till we graduate, till we become anything we want to be as a psychology student. It's very important. And I want to point out here that this is the level of disorder, the disorder we often refer to as, not we as professionals, but in our society we refer to it as madness. Yes, this is the disorder we often refer to as madness. Now let's touch a lot of things about that now, right? Like DSM-5 said, DSM-5 TR said that schizophrenia refers to problem in reality, yes, in being in touch with reality, and having several symptoms we'll be talking about. So individuals with schizophrenia have this altered reality, right? And according to DSM-5, the symptoms of schizophrenia are divided into two: the positive symptoms and negative symptoms. Please, there is nothing positive about the positive symptoms of schizophrenia. Please take note. We also refer to the positive symptoms as the behavioral excesses. Why is it positive? Or because there is something additional, right? The negative symptom, there is something you are not doing enough. Away from normal people, if we should use that because we are doing abnormal psychology, right? Away from abnormal behavior, in positive symptom, there is something you are doing more than normal people. In negative symptoms, there is something you are not doing enough as a normal person in normal behavior, right? Or normal context. Okay, so we take it under positive symptoms. We have symptoms which includes hallucination, delusion, disjointed thinking pattern, catatonia, etc. Right? Now, hallucination, please, for a good student that really want to have everything, or you don't want to say, okay, I did well, but they gave me C, they gave me B, right? Please, when you mention the positive symptoms, give us the positive symptoms like hallucination. When you mention hallucination, please continue. What is hallucination? When we say hallucination, we are talking about these sensory perceptions or stimulations sensory perceptions without any stimulation, or should I say sensory stimulations without any sensation. You start having sensation that does not exist. You start having your sensory organs being stimulated. For example, you start hearing things, normal behavior on a normal you shouldn't hear, right? You start hearing that is what we call auditory hallucination. Visual hallucinations, you start seeing angels, right? Gustatory hallucination, you start testing, oh, this is testing like air. Okay, I don't know who knows how air tests, right? Okay, you start perceiving, you can perceive this is test I perceive this, I can perceive white, this smelling like pink, right? Okay, those kind of weird perceptions. So hallucinations, those are the examples: visual, auditory, gustatory, olfactory hallucination. Tactile hallucinations, you receive a nice sting by a scorpion or an ant that does not exist, and it will be paining you there, and nobody will understand it because it's not real, but you know it's real, and you are feeling it because it's real in your own world, right? Okay, now that is for hallucination. Then we have delusions. When we say delusions, these are the key word firm beliefs despite evidence to the contrary. You have firm beliefs about weird beliefs despite evidence to the contrary, right? And under this place we have what we have called erotic delusions. These are situations where you may have a client that has schizophrenia and the person is telling you that she's pregnant, in fact that she's about to get married, that she's going to wed C. Ronaldo. For crying out loud, C. Ronaldo should be coming to Nigeria to play ball and not for anything, right? She might not have seen C. Ronaldo for any moment. Most times, therapists always fall into trouble in these situations because most times the object of erotomanic delusions will always be the therapists, and people that hears the client may think that the therapist is abusing her. You wouldn't know that they are just delusions, right? Now, okay, so erotomanic delusion, persecutory delusion, we have grandiose delusion, somatic delusion. So under erotomanic, I've explained that persecutory, they want to run away, that somebody want to kill them, right? That their father, their mother is against, they're about to kill them. Don't shout. If you are shouting where schizophrenic person is, they want you to keep quiet. If you chat on your WhatsApp group and you are greeting somebody else, he or she will conclude that you guys are talking about her. And if you guys continue making that noise, you may reveal her secret, that she has the power to stop the earth and that they are looking for her so that they will kill the earth, right? Those kind of delusions, that is persecutory. They are running so that you not kill them, or people against them will not kill them. Then we have grandiose delusion. This is inflated self-esteem. Like I said, they have the power to drag the sky down. You hear one saying that he's using one ear to hear you as the therapist, and using the other ear to hear what God is saying, right? They are the prophet of the contemporary, and they are the last prophet to exist. These are firm delusions, and no matter what you say, they know what they are saying. We have somatic delusion. The word soma, we should remember the word soma refers to body, right? And somatic delusion is a situation where the individual feels, for example, something is happening to his or her body, any part of his body. For example, that a cockroach is inside his stomach eating up. Hey, this cockroach should finish my kidney. Like, okay, that this cockroach is about to finish my kidney. I don't want to die, or that kind of thing, right? Then we have that is for delusions. What again? We talked about catatonia. Catatonia is a situation. You know, you and I can stand attention maybe when you want to sing the old national anthem. I don't know whether people stand. I don't know whether we do that when we are singing the new national anthem, or the reverberated new one. I don't know. Okay, I'm very patriotic. Thank you, guys. So now you can stand that, but for a schizophrenic patient or a person with schizophrenia, because let me not go there, it's unethical to say the word schizophrenic, like you are labeling them that, right? Now, they can stand one place for hours. Like you would think it's something that is more a statue, right? If they raise their hand, like those things you see, they will paint themselves like that's a catatonic stupor, right? In subsequent videos, I'll try to enumerate several types of catatonia we have. That won't be specifically for exams, right? I will consider that in right time. Yes, but for this course, get this. We have this hallucination, delusion, catatonia. Then we have disjointed thinking pattern or disorganized speech also in the positive symptoms. If you notice, there are behavioral excesses. We also call it behavioral excesses. Then in the negative symptoms or behavioral deficiencies, I've emphasized what this means, right? So let's move, right? So in negative symptoms, here we are having symptoms like avolition, anhedonia, alogia, asociality, etc., right? Which one am I forgetting? So we have avolition. Please remember to explain. Avolition refers to situation where the person is unable to execute daily chores or personal cares. Daily chores or personal cares. You must tell the person to wash his or her clothes, or brush teeth, or come and take your bath, or hey, this room is dirty, are you not going to sweep it? Or avolition. Normal daily chores, personal cares, the person is having a problem with that. Asociality. Asocial, remember we have social, antisocial, but in between social and antisocial is what? Asocial, right? So it's not warm to you, it's not hot to you, right? It just lukewarm, right? It doesn't need you, and you shouldn't need him or her, right? So you can also call it social withdrawal. Social withdrawal, so they are not interested in having those plays with you and everything, so they are socially withdrawn. Yes, but it will be expedient to point out here that in diagnosing schizophrenia, they are mostly very antisocial. That's not what we're looking at. The negative symptoms though. So that is second one in negative symptoms, asociality. Then we have alogia, or otherwise known as poverty of speech. Yes, they are very we have apathy also, like emotional flattened emotion, like their face, no expression, flattened facial expression and everything. Yeah, and then this alogia, they don't talk much. Yes. Then we have anhedonia. Anhedonia, if you remember the word hedonism, something about pleasure and everything. So when you add an as a prefix to hedonia, Hedonia, you have anhedonia, right? So simply meaning or simply referring to loss of interest in pleasurable things. When you bring football, they are not interested anymore. When you say sex, oh no, they are not interested. Okay, so and everything individuals on a normal, right, should have interest or derive pleasure in. They have that anhedonia. These are the symptoms of schizophrenia, and it will be very important to also remember, if I may have to point it out here, the dopamine hypothesis, which I may consider later, says that the chemical situation here is dopamine. When there is excess level of dopamine, especially in your forebrain, then be glad because you receive the positive symptoms. Yes, you start seeing angels. You may see your ancestors. Then you are close there, right? Let me not say your grave, I don't know. So now you start seeing those things and delusions and start speaking all of those things. And but research according to McLeod 1967 also showed that low level of this dopamine and dopamine neurotransmitter system, right, is implicated in the negative symptoms, especially in the prefrontal cortex. When they are low, remember that prefrontal cortex is the part of the brain responsible for procedural memories of how do I write, memories of how do I ride bicycle, how do I play keyboard, all those movement memories, learning to swim, learning to ride bicycle, all of those things. You see, it's a movement, motor memory, right? So when there is low level of dopamine in your forebrain, prefrontal cortex this time, there is almost negative symptoms of schizophrenia. Yeah, so this is it. So DSM-5 also provides this criteria that this one should be around 1 month, and this that is the first this thing. There is always this alteration from reality, and B talked about these symptoms, right? That these symptoms, at least 5, should be present. Yes, across positive and negative symptoms. And then we look at the next criteria, and we are saying there is significant impairment. Yes, in social, academic, and occupational functioning, and we understand that this should not be attributed to any medical condition. You remember that. Okay, next semester I'll be talking about the psychomimetic effects of drugs, or some drugs that we call the psychedelic or psychotomimetic drugs, right? These are drugs that have symptoms of psychosis, like Indian hemp, we call it marijuana, right? Cannabis, the cannabinoids, the cannabidiol, that is the 2 active ingredients in cannabis, right? So you understand that once these persons take it, they have altered reality. They can see, in fact, if they quote Bible for you, check it, they are correct. And that's why you see most of those singers, they will shout and tell you that I can see your spirit moving, that kind of thing, right? So they are already high and they can see a lot of things in that situation. So this level of psychotic manifestation, manifesting these psychotic symptoms, is not schizophrenia. So that criteria is telling you it is not best explained or attributed to the manifestation of these psychotic symptoms as induced by substance or any medical condition, right? And the last one says it's not best explained by any other psychotic disorder or psychological disorder. like bipolar. Bipolar can really delusionalize. Let me use that word, right? Yes, bipolar is also good in grandiosity and several psychomotor activities and agitations, right? So this is for schizophrenia. It will be important to point out here that schizophrenia has been widely researched and there is so much to say about it, but that will be in final year, right? I'm trying to be very coordinated specifically for this thus understanding psychological disorders, right? Yeah, we'll stop it here. This is what we have on psychotic disorders. Thank you, and please remember to subscribe, like, and share. Thank you very much.